This is an overview of the human veins using the images from the McKinley textbook. Here you see the systemic veins, all of which will drain into the right atrium. In this view of the heart, you can see that the superior vena cava drains blood from above the diaphragm, and the inferior vena cava drains blood from below the diaphragm. The inferior vena cava's main branches or tributaries are the right and left common iliac veins. The superior vena cava's main tributaries are the right and left brachiocephalic veins. Here you see the venous drainage of the right side of the head and neck. Here is the right brachiocephalic vein. It is formed by the joining of the right internal jugular vein and the right subclavian vein. The internal jugular vein drains the interior of the skull. It receives blood from the dural sinuses. These are sinuses within the dura mater. The external jugular vein drains blood from the face through a variety of facial veins and their branches. An important tributary of the right subclavian is the right vertebral vein, while the vertebral artery, which parallels the vertebral vein, drains blood from the brain itself. The vertebral vein drains blood only from the neck. Here you see the dural sinuses. The superior sagittal sinus drains the cerebrospinal fluid. There are other dural sinuses. We have not required you to learn the names of any of the other individual ones. Here you can see that they all join together to form the internal jugular vein. Drainage from the face also empties into the internal jugular vein. Here you see the thoracic blood supply. The heart has been removed in this image. You can see the cut end of the superior vena cava here and the inferior vena cava here. Posterior to the heart and visible in this view is the azygos vein. The azygos vein actually begins below the diaphragm. It forms just below the diaphragm, but it runs through the thoracic cavity and it empties into the superior vena cava. Before it does, it receives tributaries from a number of other vessels, including an accessory hemiazygous vein. Here you see the intercostal veins, paralleling the intercostal arteries. The right and left brachiocephalic veins are fairly parallel to each other. Each one is formed when the internal jugular and subclavian veins come together. Internal jugular and subclavian. You can see the external jugular branching off of the subclavian on both sides. The subclavian, as it moves out into the area of the armpit, becomes the axillary vein, the deep vein that is going to supply the upper limb. Below the diaphragm, coming into the inferior vena cava, you see the cut ends of the three hepatic veins. The liver has been removed in this view, showing you what would be in the interior of the liver. The hepatic veins drain the blood from the capillaries of the liver and empty into the inferior vena cava. The renal veins also drain into the inferior vena cava. This is the right gonadal vein. It also empties into the inferior vena cava, but it's parallel on the other side. The left gonadal vein empties into the left renal vein rather than the inferior vena cava. This is unusual, but it is fairly consistent from one person to the next. Again, the right gonadal empties into the inferior vena cava, but the left gonadal empties into the renal vein. The inferior vena cava is formed by the joining together of the right and left common iliac veins, each of which is formed by the joining together of the external iliac and internal iliac veins. This is very parallel to the associated arteries. common iliac, external iliac, and internal iliac. The right and left internal iliac arteries drain blood from the pelvic organs. The right and left external iliac veins are continuations of the femoral veins in the thigh. Here we see the drainage of the hepatic portal circulation. The hepatic portal vein itself ends by branching into right and left branches of the hepatic portal veins. There's a branch off to the gallbladder. The hepatic portal vein is formed by the joining together of the superior mesenteric vein and the splenic vein. Notice that the inferior mesenteric vein in humans drains into the splenic vein. Here are the gastric veins. They also drain into either the superior mesenteric vein or the hepatic portal vein. So we have lots of mesenteric veins. Most of these will coalesce into the superior mesenteric vein or the inferior mesenteric vein. The inferior mesenteric vein drains into the splenic, which drains blood from the spleen, also from the pancreas, although not shown in this picture. From the inferior mesenteric vein, the splenic joins with the superior mesenteric to form the hepatic portal vein. And the hepatic portal vein ends when it enters the liver by branching into right and left major branches. The blood from there will go through the capillaries of the liver. Here you can see a micrograph showing the capillaries of the liver. All of that blood will drain into a central vein in each lobule of the liver. Those central veins will eventually drain into the hepatic veins. So hepatic portal enters the liver from the inferior surface. The hepatic veins drain the liver from the superior surface, emptying into the inferior vena cava. Here's the venous drainage of the right upper limb. Digital veins drain into superficial and deep palmar venous arches. These are anastomoses, which can drain into either deep or superficial veins. Our deep veins run close to the bone and are named for the bones. There is a radial vein and an ulnar vein. But we also have a number of superficial veins. In the midline of the forearm, there is a median antebrachial vein. The branches of this vein are variable. Typically what you see is a V branch right at the elbow, the median cubital vein. And the median cubital vein drains into either the brachial vein or the cephalic vein. These are superficial veins, shown in light blue. The radial vein and ulnar vein, the deep veins, are going to end when eventually they dump into the brachial vein, which is the other deep vein. The brachial vein runs along the humerus. The brachial vein eventually becomes the axillary vein, which then becomes the subclavian vein. Anytime a vein or artery is named for its region, as it moves out of that region, it has to change its name. So again, we have median antebrachial, a superficial vein in the forearm. Median cubital, usually a V shape at the elbow, this is called the antecubital fossa. The cephalic vein and the basilic vein. Here's the venous drainage of the lower limb. Again, we have digital veins supplying the toes. We have some kind of a venous arch in the foot. And again, superficial and deep veins. The deep veins are going to parallel the arteries and have the same names as the arteries. So you're going to have an anterior tibial, a peroneal or fibular, and a posterior tibial, draining into a popliteal vein, which continues as the femoral vein, which eventually, as it crosses into the abdominal cavity, becomes the external iliac vein. Additionally, there are two major superficial veins, the great saphenous vein, all the way from ankle to hip, and the small saphenous vein, laterally from ankle to about knee region. Superficial veins are extremely variable from one person to the next. Here's an overview of the fetal circulation. You can tell this is a fetal circulation for a couple of things. It's attached to a placenta by a large umbilical vein and a pair of small umbilical arteries. If you follow the umbilical arteries backwards into the body of the fetus, you see that the right and left umbilical arteries are branches off the internal iliac arteries. And we can tell these are the internal iliac arteries by following them backwards. This is the aorta. We know that because we can follow it back. So this is descending aorta. It ends by branching into right and left common iliac arteries, which branch into external and internal iliac arteries. So these are the internal iliac arteries on either side of the urinary bladder, and the umbilical arteries are branches off of them. They carry blood out to the placenta, which is where gas exchange as well as nutrient and waste exchange occurs. Oxygenated blood returns to the fetus through the umbilical vein. The umbilical vein joins to the inferior vena cava, bypassing the hepatic portal circulation. This bypass here within the depths of the liver is called the ductus venosus. The ductus venosus is a continuation of the umbilical vein. It carries oxygenated, nutrient-rich blood to the inferior vena cava. That blood preferentially will cross from the right atrium through the foramen ovale directly to the left atrium. And from there it will get pumped out the aorta and supply the body with mostly oxygenated blood. Some of that blood will, of course, go into the right ventricle and out through the pulmonary trunk. A lot of that blood will preferentially go through the ductus arteriosus to get straight from the pulmonary system to the aorta. This does two things. It allows more of the blood from the umbilical vein to go straight to the systemic circulation, and it bypasses the fetal lungs, which right now are not inflated, not functional, and simply need enough blood to grow. So again, the fetal specific structures: umbilical arteries, umbilical vein, ductus venosus, a bypass through the liver, foramen ovale, an opening between the right and left atria, and ductus arteriosus, a bypass between the pulmonary trunk and the descending aorta.